Thanks, May. Well, I appreciate the opportunity to be here, and given her extensive background, she probably does not need an introduction, but I'm honored to introduce Assemblymember Cecilia Aviara Curry. She was elected to the State Assembly in 2016, and during her tenure, she has passed and carried numerous significant pieces of telehealth legislation, becoming a key champion for expanding telehealth to increase access to care, especially in rural and underserved communities throughout the state. Her legislation has also helped build the foundation for many of the state emergency directives regarding increasing telehealth use during the first months of the pandemic for clinics and for providers. So the Assemblymember has additionally fought to expand broadband access, which is foundational for the use of many telehealth technologies, and she will most definitely continue to be an important ally to the telehealth community as we seek to further ensure progress in the state. With that, I'll turn it over to the Assemblymember.
Well, good morning. Hi, everyone. Good morning. How are you? Thank you for having me today. It's an honor to be called a champion, but let's face it, all of us that are on this call are champions. This kind of work is not done by one person, it's done by a team. And before I get started, I wanted to thank my legislative director, Angela Pontes, who's worked with probably every single one of you on the call that has helped give me good direction and help make sure the policy is what we want it to do. So with that, I just want to thank you all for including me today. And it's definitely an honor to be here to speak with you again this year. Again, my name is Cecilia Aviara Curry. I represent Assembly District 4, which is 6 counties in Northern California, primarily. They're actually all rural. It's very progressive or very conservative. It's always a crapshoot, as I call it, when you go out to the district, because it's so different all the way through the district. And number one has always been access to me. I just wanted to say I'm just honored to be as you call it, a champion. And to me, every day is all of our hard work. We're all the champions on this. I've seen so many of you in my office working with my staff to make sure that we deliver great policy for our constituents. And number one, I will always tell you is that I always want policy that we write is to be transparent, accountable, and the number one is to make sure it can be implemented. And the telehealth policy that we have done with your help and guidance, it is being implemented. And unfortunately, it was the COVID that kind of drove that, but that's where we are today. You know, when I came to the legislature 4 years ago, I had a goal, and I quickly learned from my constituents that telehealth has been a transformative tool for both health providers and patients. I'm using innovation in healthcare to provide access to people in rural and isolated communities is an accomplishment on a regular day. Then think about the impact that this technology has been able to provide during disasters like wildfires, and who would have thought we would be dealing with COVID-19 pandemic. However, what I do know is that I do not have to convince any of you on this call about the many benefits of using telehealth and the importance of providing even better access, reimbursement, and coverage for millions of Californians. COVID-19, the expansion of telehealth during COVID-19 pandemic has been one of the few silver linings of this challenging time. Telehealth has transformed healthcare during the pandemic. Telehealth visits have allowed patients to maintain timely access to their care, and all while mitigating exposure to COVID-19. Just like during the many wildfires and natural disasters before this, our first responders and healthcare providers are often on the front lines, making sure that their care is provided for and making sure for those that are all in need. I'm particularly aware of this after authoring multiple bills to make sure that when there is an emergency, providers can provide health care to their patients using telehealth. And those providers can actually bill and get reimbursed for their work. Now, I will be the first to admit that when I authored AB 1494 2 years ago, I never imagined that this first implementation would be for the pandemic. However, this bill and my telehealth parity bill, AB 744, have been amongst my proudest accomplishments in the legislature. And why? People throughout the nation are looking at what California does, and they're starting to follow. It has been especially rewarding for me to see how this legislation has been implemented today, and that people can safely continue to access necessary and preventative care from home, and the doctors are providing that care that can so they too can stay safe and get paid for their work. It was not without strong advocacy and support from many telehealth facility patients and provider groups that we are able to accomplish this legislative and cultural changes. However, with all accomplishments, there is so much more to be done, and I'm looking for you for some guidance. So my legislation priorities have remained the same because my goals for California focus on the needs of many people in our smallest, rural, and lower income communities. Broadband access, infrastructure development, and telehealth have always been my focus. When you represent a rural district, access is always central to everything. COVID-19 has highlighted that in many areas of the state, telehealth means a phone call. It is not always, and it's not always just on video or only on video. This is a component I aim to address. We've got these services covered during emergencies, but healthcare should not be contingent on a disaster. I believe that it is important to take advantage of this time and this opportunity when the benefits of telehealth have come front and center. Under state emergency guidance, providers can deliver care through telehealth and bill for it in a way they cannot outside of an emergency. Unfortunately, these current flexibilities are dependent on the federal emergency being maintained, a factor we cannot control and cannot rely on under this current administration. If public health emergency is not renewed or the national emergency is rescinded, these telehealth flexibilities will end immediately. The progress, our investments and safety that we have achieved will be all undone. I aim to push the governor and many of my colleagues to extend the law and the values of remote access to healthcare indefinitely, not just in emergencies. Providers and facilities cannot operate on a month-to-month basis. They need to know that they will be able to continue to offer services through telehealth. Administratively, that's a mouthful, operating a clinic without being able to confidently budget for the next month is not realistic. As we know, many are going from month to month, and they need to have some stable funding coming through. I was working on this policy during the last few weeks of the session to do just this, but unfortunately, the policy bill got held up due to timing and to budget concerns. My proposal will remove the current emergency trigger for telehealth flexibilities and eliminate the Medi-Cal exemption from telehealth parity statute. This is follow-up legislation to my previous bills. It's critical that I will be reintroducing this next year. I know this is important to all of you, and you know that I'm going to work hard to get legislation through. The COVID-19 emergency has highlighted opportunities in the healthcare delivery system that can allow continuity of care through taking advantage of innovation, technology, and access to the internet. We need urgent action to give our hospitals, our health clinics, providers, and constituents confidence that their ability to deliver and receive care through telehealth will not be revoked overnight. In addition to access, during the pandemic, telehealth provides safety. We can protect healthcare workers and patients from unnecessary exposure while guaranteeing care. We are preparing for flu season, working with the wildfire season, and preparing for an unpredictable second COVID surge in the winter. I'm aware of the governor's veto message on 2164 and his indication that there might be telehealth policy in the budget proposal. Well, I think that's great. However, I'm eager to see that the what the administration may propose in January, if they do. However, I do not believe that this is an issue that any of us can wait on, and I will be pursuing legislative vehicle in December. Many of my colleagues and I feel that going through the full process of vetting and voting on policy is the most transparent means to legislate. And as I said before, I want it transparent. I want to make sure we have accountability, and I want to make sure it can be implemented. It cannot always be done through executive order or through the budget. My colleagues have to trust in the policy that all of us will put together. So your support and your voices really do make a difference on these efforts, which is why I'm excited to be here to talk to you again today. It's important to continue this dialogue. So with this, I'm sure that you all have some questions. I'm happy to address whatever you have with the remaining time. But quite frankly, we need this to get additional telehealth legislation through this year. Make sure you work with your legislators. Many of them see the importance of this. I already have 12 women signed up saying, what can I do, or how can I propose additional good policy? So thank you very much. And if you have any questions, I'll be more than happy to answer a few of those.
Thanks so much, Assemblymember. Yes, I think we have time for a couple questions, so appreciate you staying on for that. I think the first question I'm seeing is from Mike Kurland. First, he thanks you for being a tremendous leader and advocate for telehealth. And then he's asking if you could help us understand what you think some of the sticking points or hurdles will be as you're trying to enhance telehealth access, and then how we as coalition members can be of more help to you.
Well, it always has to do with money, correct? And with the budget the way it is, a lot of things with money involved is going to be a challenge. I think that we also need to prove to the administration the importance of telehealth, our success stories, our opportunities, where eventually I think we will be able to be cutting costs. So those are the things I think will be challenges this year. It's also educating of the administration on what we have done and what all of you have done. I would love for some letters of support that comes into my office or to the administration of just telling people how it's worked. And I think one thing is that we've talked a lot about at the administration is about homelessness. And linked to that is obviously mental health issues. We have seen through telehealth an incredible amount of people now attending their appointments. They can do those over the internet. And I think that's a way that we're going to have to go, because we are struggling with the amount of mental health professionals. And the other one is I think we need to encourage some of our skilled nursing friends. They're nervous about this new technology. New technology is not cheap, but I think in the long run, as we pencil things out, that it is affordable, that you learn how to use it. Let's face it, new technology is always a little bit frightening. It's kind of ironic. This morning, Larry was on a telehealth call, his very first one, and he came out of the bedroom and I said, how was it? And he said, it was great. So, this stuff works. So we have a lot of help to work on, and any suggestions, please let us know.
Thank you so much. I think we have just a couple minutes left. If there's anybody in particular that you think we should be, as a coalition and members, as we look to how we can help you in this fight to progress telehealth access, is there anybody in particular that you think we should be working with? And then is there anything broadly on health information technology and having coordination at the administration level that you would also like to add?
Well, I can see a couple of things coming down the pike. I believe today there is a health committee meeting. A lot of our meetings are now on, they're going down the data collection and how we can share information, which is important, obviously, through telehealth. But obviously, we have a lot of restrictions with that, with HIPAA, those kinds of things. So those are technicalities that we won't be addressing necessarily, but the industry will have to start identifying some of those. And I think that, one of the toughest things is why some people aren't in using telehealth is because we don't have good internet connections. And so I'm also doing a bill for Internet for All. I'm hoping I get good support from the healthcare industry. Let's face it, is that the pandemic has put some of these important issues to the forefront, and healthcare, Internet for all of those are really, are really important for all of our constituents. So we'll be working on broadband, making sure that we can get our communities, our hospitals, our fairgrounds, our anchor institutions all hooked up with Internet for All. So those are the things that I think all come together, and that's a top priority for me. It's all about access. And when I say access, I don't want anyone to think that I'm not thinking of urban areas as well. We have pockets of urban areas that don't have connectivity and don't have access to good healthcare or specialized healthcare. So we have to keep those to the forefront as well. So it's, this state is so big, and you have to think about so many things. And so those are the things that are on our mind. But again, I just want to reiterate, I need your help. And you guys have been there nonstop. The success that you've seen with our bills will continue, but I need your help and your recommendations, and we'll have continued challenges along the way. But and I'll be taking some risks, because to do good policy, you have to take some risks. But again, it comes down to implementation. And we've seen telehealth, it's working.
Thank you so much for your time and all of your work. We really appreciate it. And yes, the coalition stands ready to help you and support you in any fashion that we can. So thank you again for your time and all of your work. And then I think I'm passing it over to May now.
Thank you.
Thank you, Assembly Member, and thank you, Amy. I've been doing this for over 10 years, and she is one of the most passionate speakers about telehealth and one of the more knowledgeable people. There was a reason why the coalition selected her as our 2019 champion for telehealth policy. So thank you, Assembly Member, again for taking time out of your busy schedule and for all the work that you do on behalf of telehealth.
Thank you, and bless all of you. I appreciate everything you're doing.
Thank you. Have a great day.